Hey, this is Joe with Grandview Aesthetics and Plastic Surgery. Today we're talking with Dr. Nanda and we're talking about hair replacement. What options do people have for hair replacement, Dr. Nanda?
So this is a really hot topic for guys. So for women too, but a lot of guys come in and we get embarrassed of our hair thinning. Why does that happen? Hormones change, times change, age goes up, never goes down. So what are the options out there? A lot of people will start trying Rogaine or some type of medicated shampoo. We have a bunch of different shampoos that are prescription grade, actually better than Rogaine and safer for your body. People will try testosterone shots. Some people try PRP, which is microneedling, and they try to stimulate the follicle. Some people go to hair transplantation. We actually do all of those things we mentioned. So we actually have shampoos. We actually have vitamins and supplements that will help. We actually do a lot of microneedling, which is drawing your blood, separating the strong cells from the weak cells, and then we microneedle that back into the scalp and we actually regenerate these dormant follicles, and they actually start becoming active again. You actually start growing hair again. That's a very quick and easy way of doing it. And if you have a little bit more of hair loss or you want a quicker response, we can actually do hair transplantation with something called the neograft.
And what exactly is the neograft?
So there's two different types of hair transplantation out there right now. There's one called FUT, follicular unit transplant. And there's one called FUE, follicular unit extraction. The differences between these two is actually quite simple. With follicular unit transplant, we actually use a scalpel and we make a big slit of skin about this big on the back of the scalp. And then we take that flap of skin and we actually pull the hair follicles out and we implant them wherever you want to grow new hair. That's FUT. That's one of our competitors called Bosley. They do a lot of that. We thought that there has to be a better way. We use what's called FUE, follicular unit extraction. So we actually have our machine and it actually will go either in the back of the head or here. We can take the donor hair from the chest to the back or wherever you like. We extract that hair. We actually are extracting follicles. One follicle can be 2 to 3, 4 pieces of hair. And then we implant that actually wherever you want. But we're doing this now without any scalpel, without any stitches. FUT, what our competitors use, they take that flap of skin, now you have a big chunk of scalp missing and we have to stitch that together and pull it together. Often leaves a bad scar or a keloid. We don't do any incision, there's no scalpel with this. This is just quite simply using our machine to extract these follicles and plant them where they need to go. A much more effective method. It actually lasts longer, there's way less downtime, way less pain. You can go exercise quicker, return back to your regular activities faster.
Some people who get this done, they're actually watching their favorite shows or reading a book while it's happening.
Absolutely. We've actually had people come in and have board meetings while this is being done, literally, because you're completely awake. There's no anesthesia really. There's just a local anesthetic with lidocaine. We actually have laughing gas if you want. If you're really scared, we can give you that. That way you'll feel really nothing. But you're awake the whole time. You're watching Netflix or you're working on your computer. You're reading a book while my transplant team and I do this. So we actually have a transplant team that comes from out of state. These guys are excellent at it. They work in conjunction with me and we as a team do this and we actually have amazing results.
And how long does the process take from start to finish?
So it can take anywhere up from 4 hours up to 7 hours depending on how many follicles you want. And I know that seems like a long process, but the process is long because we actually examine the hair. We actually see where you want to do the transplant. We actually draw on the hairline, make sure you like that. We then will take those donor site hairs. We look at them underneath a microscope. We pick the good ones and we implant it in. That's a long process, but this is a one and done. You do one procedure and then you're done until you think that maybe you want more hair in that area again. But this is actually very natural. This is your hair. We're not using fake hair. This is not plugs. And then you're finished. You're out of here. So in reality, it's not bad. We can do this 7 days a week, whatever day works best for our patients.
And how does it heal? How does it look when it's healing, and what is the process for that?
That's a great question. So basically, they look like little plants that have been planted in the hair, and they start developing blood supply around it. And just like you grow normal hair when you're a baby, this hair will start to sprout and it'll shed, and then you start having real hair behind it. So you start seeing a benefit quite quickly. However, to get that real hair back in, it can take up to 6 months, and that's a natural process. No matter what method you choose, that's the time frame for it.
And is there financing available for this?
Yes, we have 0% financing going on right now, and we can actually finance you for up to 2 to 5 years, depending on what's best for you and your credit. We have options for everybody. So, and we actually have a lot of promotions going on right now. So call us. There's nothing to lose. It's a free consultation. We'd love to get you guys in and talk to you.
And what is your website and how can you make an appointment?
So you can see us on our website, greatskinohio.com. On that site, you actually will have a lot of information for Neograft, the procedure. You can call us at 614-421-SKIN. We'd love to talk to you.